Hi, Steve Adler. Good evening. Got a minute? All right, let's go ahead and talk. Once you know, I missed you talking to you last week. I was kind of hoping the numbers maybe just go down. You wouldn't need to hear from me. Numbers are going up. So we're back to watching the numbers pretty closely. Before we go back, I want to thank everybody again for supporting Proposition A. Mass transit in the city won by a huge margin. It's going to be transformative and generational for the city. Help us with traffic, climate change, real importantly, help us with mobility equity in the city. That's a big deal after not being able to pass that over the last 2 decades to pass it now. Congratulations to everybody in our Central Texas delegation up at the Capitol here in Austin that continued to win their seats. Congratulations to President-elect Biden. I hope that he and Vice President-elect Kamala Harris can bring the country together. Having gone through this election campaign and watching what happens, mainly on social media and the like, where folks are just so polarizing, saying a lot of things that just are not based in fact, and making it more difficult to actually have reasonable, grown-up conversations, which is what we desperately need, especially in our city. We need to actually talk about what we do with people experiencing homelessness. We can't wish it away, and we can't hide it. We're not doing a good job of managing our shared public spaces. So as a community, we need to figure out what we do. And how we get people out of tents and off the street corners, because no one wants that. But how do you do that without just hiding people? How do you actually improve people's lives? Remember, this is a relatively small number of people for a city of our size and our wealth for us to actually take care of. We need to figure out policing and public safety. Everybody wants the city to be as safe as it can possibly be. And there's got to be space and a room for people to talk about new and better ways for us to achieve that, especially when not everybody feels safe with the same kind of structure. We saw this summer a large part of our community does not share the same sense of safety that most of us do, and we can and should and need to do better. And being able to figure out what it is we need police to do and what we can have other people do, like mental health interventions and social service work, and providing safe places for people to leave so they can leave homes where they're in horrible situations, domestic situations, before they result in a police call. These are all things that our community needs: a safe place for people to engage in honest conversations. And my hope is that now, with the election over, people won't be trying so hard just to make us scared of one another and scared of ideas, and actually promote us listening to one another. Um, let's hope that's not something that is too far afield from something we can achieve. But the first thing we're going to need to be talking about is how we deal with this virus, because as we look around the state, there's a lot of concern. El Paso right now is in a world of hurt. Dallas approaching that way. Houston, San Antonio, numbers scarier than ours, and our numbers scary enough by themselves. But let's talk about the numbers. Let's talk about where we are and what it is that we need to do. The first chart shows you the numbers. We can see that new admissions today are 25. That gives us a 7-day running average of 30. Wasn't that long ago when our 7-day running average was 12. We were trying to get it to below 10 so we could get down in that blue zone on that chart you see in the middle. We have gone from 12 up to 30 at this point. The chart itself says that if we get to 40, then we start moving into the orange zone, and you can see that we're headed in that direction. We'll talk about that in a second after we go through the numbers. Number of new cases today, 157. that's down. That could be a function of the fact that we don't have a lot of cases reported after the weekend. Monday's numbers are usually lower numbers. Let's see how we do over the next few days. The 7-day moving average up to almost 200. Recall that we were down at a number that was closer to 50, now at 200. 7-day moving average for hospitalizations, ICUs, and ventilators, 168, 58, and 28. That's the 7-day average. Let's take a look and see how we're actually doing tonight, so we can see how we're doing with those 7-day moving averages. Number of people in our hospitals, 182. Remember, the 7-day moving average hospitalizations is 168. So the actual number tonight is higher than our 7-day running average. Number of people in ICU, 64, which is higher than the 7-day running average of 58. Number of people on ventilators is 32, higher than our 7-day moving average of 28. So all three of those factors, today's numbers, are higher than the 7-day moving average. And note that oftentimes those numbers on a Monday are lower, the actual numbers, because a lot of people don't move into hospitals on right after the weekend. So that's a concern. 466 people have passed away. That didn't change from yesterday. 466 people, more than 10 times the number of people that have been the victim of homicides in our city so far this year. So in a shorter period of time, more than 10 times as many people have died from this virus. This virus represents the single largest threat to public safety, your safety, in this community. So let's talk about the numbers that we see and then what we're seeing. Tomorrow we get the numbers from Dr. Escott, so we'll show you a lot more charts tomorrow with respect to infectivity, positivity rates, and show you the demographics. But what we know is that at this point, I think that the number is going to be in Austin about 130 infections per 100,000 people in our city. Go to a city like El Paso right now, it's over 4,000 infections in that same group. That's why they're having so much difficulty there. But it started there. Remember, their numbers used to be as low as our numbers got to, lower than what our numbers are now. We have patients in our hospitals right now from El Paso because there wasn't room for them in El Paso. We have people in our hospitals right now that don't have virus, but needed hospitalizations, and they're here from El Paso because there was no room in the El Paso hospitals. We talk about having no room in the El Paso hospitals. That's even with the governor sending over, I think, like 900 additional medical staff, because that's really where our systems get stressed. We have physical space, but as we learned in June, July, the real threat to us is having people so that our staffs are overwhelmed. And we can't even fill up the beds that we have. 900 medical professionals sent to El Paso. Dallas has, I think, 4 times as many infections per 100,000 people as we have in Austin right now. The governor's begun to send healthcare professionals there as well. I will suggest to you that if that happens in Dallas, they need more help, then Harris County needs more help, and San Antonio does. By the time they get to us, there's not going to be additional help coming our way. We're going to have to just work and do the best we can with the resources we have. I hope that's not true. I hope our hospitals can bring in people from different parts of the country, but that's the concern right now. When we were building those models, the green, blue, yellow, orange, red, we were recognizing that we had about 340 intensive care unit beds that were available for people, and therefore we knew we couldn't go over 340. So we set those trigger rates so that we would be able to stop before we got to that place, recognizing that on the day we changed behaviors, it was going to be 2 weeks to 3 weeks before we actually saw a decrease in hospitalizations, because it takes that long. Someone who gets infected today, if we change our behaviors, gets infected today, 3 to 7 days before they're symptomatic, before they go get tested, day or two, three before they get the test results back. Then they're going to be quarantining at home. Some of them will end up in a hospital, but that'll be probably 2-3 weeks after they got the infection. So if we change behaviors today, we're not going to see a lowering in hospitalizations for 2 or 3 weeks. In that 2 or 3 weeks, our numbers will continue to go up. So we set triggers to make sure when we hit this trigger, we know we couldn't move forward. We couldn't. We had to change our behaviors, or else we would ultimately 2 or 3 weeks later overrun our ICUs. We based that on 340 ICUs available. But what we learned in June or July is when we get to that place, we can only actually staff about 200 of these beds, which means that the triggers, as we get from orange, we need to go into red, probably are going to come down. But we'll be taking a look at those numbers so that as a community we can follow them. We are not at the place yet where we have hit the trigger requiring the real drastic action, but we could be just a few days away from moving to orange, which means more care, staying home a little bit more. And then if that doesn't work, a week or two later, not very far off, we could be looking at taking more drastic action, which none of us want to take. I don't know what that more drastic action would look like. We want to keep our schools open. We want to keep open businesses as much as we can. I will tell you right now that if this community is really concerned about keeping schools open, and notice that Austin High just closed for 3 days so that everybody could get tested because they got infections. We want to try to keep our schools open, or more of our businesses open, then everybody has to wear masks. When you are not in your house and you are around people in public, you should wear a mask, period. Everybody should be doing that. Anybody that you see that's out in public in a store not wearing a mask is somebody that's putting opening schools in danger, in jeopardy. Anybody you see in a group of people out in public that is not in their household group is putting at risk keeping our schools open, keeping businesses open. I've heard people say that they don't think masks work. Not true. Virtually every doctor in the world says that masking helps. Certainly you can find one or two if you go on social media that say otherwise, but it is overwhelming that masking helps. And we've seen that in our community twice, in April as well as in July. Masking works. And I've heard then some people say, well, I don't want to wear a mask and I'm entitled to take that risk for myself if I want to. And that is not true. Because if you're not wearing a mask, you're not taking a risk with you. You're actually probably protected if you're around people that are wearing masks. If you don't wear a mask, the person that you're taking a risk with is me and my children, my grandchildren, your children, your grandchildren. It's the people that are trying to go to school. It's the people that are trying to open up businesses. As a community, we have to set the cultural norm that if you're out in public, you're going to be wearing a mask. And most importantly, this includes being around friends and family. What we're seeing a lot from the contact tracing, as best we can tell, is that people are doing a fairly good job of wearing masks when they're out with strangers. But in the evening when they're socializing and they're with members of their extended family or members of their extended network of friends, they don't wear their mask because they know their friend or their family member. They think, well, I know this person. Surely they're not going to be carrying the virus. You can't think that way. Our friends and our family are just as likely to be carrying the virus as anyone else, and they might not know it. They might have gotten it so recently that it hasn't shown up in symptoms. They could be asymptomatic, and about a third of the people asymptomatic are infecting other people without even knowing that they have it. Somehow or another, if we want to keep schools open, we want to keep businesses open, we've got to start wearing masks in the evenings when we're socializing with people outside of our homes, even with friends and with family. Or else, here in another 2 or 3 weeks, we're going to be looking at having to take more drastic action that none of us want to take. So I won't say it again. I've already said it too many times. Actually, I will say it again. I'll continue to say it because I am desperately trying to keep our schools open for our kids as best we can. That is up to us. Anybody who is out in public not wearing a mask is being selfish. If you go into a restaurant, make sure that you're sitting at your table eating if you take off your mask. If you go into a restaurant, better to be outside than inside. If you go to a restaurant, have dinner with your family, with the nuclear people that you're around with at home. Much better group to be out if you're going to go out and eat than with people that are not in your home. Keep your groups as small as you can. We don't have much longer to go. We need to weather this as best we can. We need to show greater discipline than we're showing right now because the numbers are headed in the wrong way. Soon there'll be a vaccine. Don't know how soon, but we did get news today of yet a second vaccine company that published some of their results, showed that they were 94.5% effective. Those are just press releases. Those are not the scientific studies that still have to be published so that they can be peer reviewed. But this is now the second vaccine company by press release that has indicated success at over 90%. What's particularly encouraging about this is both these vaccines use the same kind of methodology in order to be able to create the vaccine by creating I'm not exactly sure what my understanding is they create through genetic engineering the precursor in the body to create the antibodies that your body needs in order to be able to fend off the virus when you become associated with it. Relatively new technology, being originally thought to be used for other illnesses, but then COVID hit and they both tried to use this new technology in this context, and they both seemed to work. And the fact that they used a similar methodology is an encouraging sign. But it's going to be right after the first of the year on a very limited basis. If this still proves to track and to work, it's going to be hard to deliver. Looks like it may take a couple shots. Applications in order to first and then a booster, maybe something that has to be kept at a really, really, really cold temperature, which is going to make it more difficult to administer. It looks like it's going to be late spring into the summer before it's available for everybody. So it's not going to be coming quite away. We have to get used to wearing the masks and the face covering for an extended period of time, but it is a small price to pay in order to be able to keep our kids in school as best we can. To that end, on behalf of Austin Public Health, I want to say that if you or anyone that you know comes positive with the virus, please participate in the contact tracing effort. We're finding that more and more people, when they get the virus, they get contacted by Austin Public Health, and they say, okay, where have you been? Who have you been around? We have people that are reticent to share that information with Austin Public Health, and they shouldn't. We need people to be open to share that information. There's no penalty. There's no stigma. But let us see where it is that the virus is showing up so that we can tailor our responses. Let us find who it is that may have come into contact with the virus so we can let them know so that they can isolate themselves, quarantine themselves before they spread it to someone else as we give them a free test to see if they have the virus. But this is a plea to the community to participate with Austin Public Health with contact tracing. Please give the information requested. You can help slow the spread of virus by sharing who you've been in contact with, and we need more and more people to be open to doing that. This is coming at an awkward time for us because we're headed into Thanksgiving and the holiday season. Makes it harder and harder to do the things that we need to do in order to keep everybody safe. The city of Austin has published some suggestions for people to consider when they are doing the holidays. Low-risk activities, obviously celebrate with members of your household, decorate your living space, hosting a virtual gathering with friends and family, prepare traditional recipes, deliver them to people that you know in a contact manner. Leave it on the front stoop, and then text them and say, "Come on outside and grab it," as you hop back in your car and get back home again. What a great time to be watching holiday-themed movies or shows with your friends. That's what you want to try to concentrate on. Medium risk activities, try to avoid these if you can, but they're better than high risk activities. On these medium risk activities, please make sure you're wearing a mask, make sure you're social distancing. Hosting a small dinner with local families and friends. If you're going to do that, keep the group as small as you possibly can and do it outdoors. And mask and social distance. Visiting an orchard and tree farms where hand sanitizer is used before touching objects, and wearing masks and social distancing. Having an outdoor parade or a movie night and wearing a mask and social distancing. Those are medium risk activities. Better to do just the low risk activities. What are the high risk activities? Please don't do these. These would be activities like participating in traditional caroling or other door-to-door activities. Attended a crowded indoor gathering. Don't do it. Going on hay rides with non-household members. Don't do it. Traveling outside your community for gatherings and events. Don't do that. Don't go outside of Austin and participate in a gathering or an event that you wouldn't be able to do if you were here without violating rules. And it goes without saying, don't attend anything in person if you've been recently diagnosed or you've had symptoms, if you're waiting for test results, if you've had an exposure to somebody in your household is at increased risk of severe illness. You live with someone who's elderly or who has diabetes or something else. Don't attend in-person celebrations. Maintain all of those safety measures absolutely as best as you possibly can. Want to just announce, separate from all this, Austin has stood up now an Austin Civilian Conservation Corps, an initiative of Councilmember Allison Alter, using some of the federal money we have, creating work programs for people that need jobs in this period of time, kind of like the old Civilian Conservation Corps, the CCC, that this country had 80 years ago. Right now, as one of the implementers of this program, American Youth Works, Parks and Public Land Improvement, they're paying people $15 to $18 an hour to help do some of the functions that the city does with fire control with trees and other kinds of work outside. Go to the website that we have associated with this Got a Minute. And you can apply. There are going to be more opportunities that become available. I'm going to let everybody go here tonight. Please wear masks. Please expect people around you to wear masks. If you have friends and family members that are not wearing masks, hand them one. Or tell them to come back when they are also follow those rules. Don't go into a bar or a restaurant where people are not social distancing or wearing masks. We are in a fight right now to keep our schools open, to keep our businesses open, and it's going to take a lot more vigilance and diligence than we're exhibiting right now as our numbers are going up. That said, we have demonstrated at least twice in this city that if the will is in our community to shut this thing down, we can. And we can do it without having a closing of our city if we will do, each of us, our part. Let's do that. I'll see you all tomorrow. We'll have more charts, more numbers from Dr. Escott. You all take care and be safe.